Welcome to the Cabinet Member for Health, Wellbeing and Social Care decision making this morning. Just some housekeeping, just to let public gallery know this is being live streamed, so that's available for to be seen on the internet as we're speaking now. And also for evacuation purposes, if we have a fire alarm, there's scheduled, so you go out the fire exit and you muster next to Queen Victoria's statue in the Guildhall Square. So if I can start the agenda, do we have apologies for absence?
Yes, Chair. Councillors Fielding and Stubbs gave their apologies.
Thank you very much, and I'm the only member here and I have no declarations of members' interests. So if we move on to item 3, the removal of the daycare cap, and I believe this is coming from Richard.
Good morning, Chair. The purpose of this report is to seek approval to remove the current financial cap of £60 applied to client contributions in respect of daycare, community support and health and independent services, bringing them in line with all other adult social care services. Currently, these services are capped so that clients will not pay more than £60 per week towards the cost, even if a client has been financially assessed as being able to contribute more than the cap. Following the removal of the cap, clients will be expected to contribute up to their maximum assessed charge based on a financial assessment of their means in accordance with the Care Act 2014 and the related care and support regulations. Section 5 of the report sets out the engagement process and the support that will be provided to clients by the Financial Assessments and Benefits team. Happy to take any questions.
Thank you, Richard. Yeah, just one question. In terms of the other services the council has, can you confirm that this is the only one that is capped in this way?
Yes, that's correct.
Thank you very much. Due to that, and obviously the two members not here today from Labour and Conservative, they just have an opportunity to look at this during our briefing that we had together a few weeks ago. I've asked both of them if they have any particular issue with this, and they broadly do not. So, and in the purposes of natural justice as well, the fact that we have a service that has a different structure in terms of capping compared to any others, I do support this and think that this should go through. So I'm happy to give my approval for this item. So then we move on to item 4, which is the Continuing Healthcare Section 75 Partnership Extension of Term, and I will ask Susanna to take us through that one, please.
Thank you, Chair. This is a request for an extension of the Section 75 arrangements, which are part of the Health Act, for integrated continuing healthcare for both the commissioning of the packages, but also the integrated team who carry out the assessments. The team and the integrated arrangements have been in place since 2012, and both the Council and the CCG agree that the integrated working is beneficial both to us as partners, but also to service users and patients in terms of making sure that they have a more seamless journey through continuing healthcare.
Thank you very much. Just as a bit of overview, how does this fit in with the work that is going on in terms of the STP and other partnership working that we're doing at the moment?
It completely supports the integration agenda. We, in terms of our peers around us, our integrated arrangements are considered to be quite forward-thinking. The fact that we integrated such a long time ago and we've been so successful. If you look around our borders, often there are challenges between health and social care around this agenda, but we don't have those. And what we're seeing is that actually in terms of the flow through the hospital, having an integrated team is much more beneficial. We don't have the delays around continuing healthcare that other systems have.
Thank you, Susanna. Again, the opposition spokespeople had an opportunity to look at this. I think as a council, as Susanna has said, we're working very well together with our healthcare partners, and this has been going on for some time. So I do think that this is something that I'm very happy to support the recommendations on the paper, and wish us well in terms of continuing this work that we're doing. So on to item 5, which is arrangement fees for self-funding clients. And it's back to you again, Richard.
Thank you, Chair. The purpose of this report is to seek approval to introduce arrangement fees from the 7th of January 2019 for self-funding clients who request that the City Council arranges and manages their non-residential care and support. Section 3 of the report sets out the background and legislation that gives local authorities the power to charge for putting these arrangements in place. And Section 4 of the report sets out how the proposed arrangement fees will be structured, the level of fees proposed, together with a comparison information from some other local authorities. Once again, Section 5 of the report sets out the engagement process and the support that will be provided to these clients by the Financial Assessments and Benefits team.
Thank you very much. Just for the benefit of those who may be watching at home or our guests in the gallery there, can you just give a bit of an overview of, you mentioned about local authorities, about what those fees are that are in there and how you've come with those comparators?
Okay, at section 4.10 of the report, we've highlighted that we've contacted local authorities within the National Association of Financial Assessment Officers, which is in excess of 100 authorities, as well as reviewing other authority websites for information on the level of fees that they charge. There's a table at section 4.10 which gives some examples of the fees where authorities are charging that we've been able to obtain from that piece of work for comparison purposes, and you can see that there's a total that gives you an annual figure of what the charges would look like for those other authorities compared to what we are charging or propose to charge.
Thank you very much. Again, as with the earlier report we had on daycare cap, can you just confirm this is for people who are self-funders?
Yes, as set out in the beginning of section 4.2, it would be those clients who have been assessed as having financial resources above the upper financial threshold, which is currently set at £23,250 nationally, or if the client does not want to provide information about their financial assessment, they will be deemed to have financial resources above the upper threshold.
Thank you very much. And again, both the opposition spokespeople had the opportunity to look at these and had their comments on them, and again, broad support. I do think we will monitor this. So if there is a trend which is possible that people might not set up packages, etc., because they have to pay for an administration fee, then we will consider this again. But certainly with the engagement that we're planning to do before any implementation later in the at the start of the next financial year, we will obviously monitor that situation, because we don't want to be in a situation whereby people haven't got care packages. But with the engagement we've got, with the fact that this is for self-funders only, and it is a relatively average amount we are looking to charge, I'm happy to also approve that recommendation as well. And that concludes the meeting. So thank you very much, everyone.